My name is Blanca Martinez Torres, and this is my project for week 7, my learning reflections. The assignment is my learning results regarding the course outcomes for this course. Select one assignment and discuss how the assignment illustrates one or more of the course outcomes. I have picked the 4.2 Clinical Information System in Action assignment discussion board. It covers the course outcomes number 1 of discussing nursing and healthcare informatics competencies as they relate to the goals of clinical practice. Competency number 2, recognize and use the importance of nursing data for improving practice. Competency number 3, analyze web-based health content for literacy level, accuracy, reliability of information for clinical population. The clinical information systems have come a long way in my work experience with patients. In the first community health center in 1992, we had a system called MedMen. I used this system also in the second community health center and was in use until 2009. Paper charts were in use, and the system of MedMen was used for patient registration, scheduling, billing, reporting, and everything was printed in a dot matrix printer. For all of you that can remember that, it's been a while. If you don't know what a dot matrix printer is, then you're probably a millennium. When the organization in 2009 made the transition to electronic health records to be complying with the new regulations, it was a transition of magnitude proportion. The organization had been able to obtain federal grant money as being a nonprofit community health center. Along with the system they had chosen called Citrix Greenway EHR Entergy. This undertaking included new computer, printers, hardware, servers to be compatible with the new program. To convert a whole organization of 7 clinics plus administration was hard on everyone. As stated by HIMA article, failure to adequately evaluate a clinical workflows and information needed associated with providing care and lack of planning during the after go-live will result in a fallback to paper, thereby jeopardizing the success of the EHR adoption. The first phase was planning a timeline of going live date, then came getting all the new hardware installation, which included addition of the ITT personnel. For most of everyone, this new change was exciting, frightening, and exhausting. Then came the hard parts, which was the training of the personnel. The training that came was very minimal and not very well planned. For most of us, after the general training, it fell on each individual to figure it out, and I was one of them, and to assist all of the others that were having trouble understanding the system. We had a lot of employees and fellow colleagues of mine that were not computer literate, period. So in rating Greenway, the system was very efficient. It also, the patient safety in the system increased, and the patient safety from paper chart and MedMen increased. Providers, progress notes, prescription orders, referrals were readable. Medication lists corresponded with the prescription written. For the nursing staff, clear and concise data was a dream come true throughout all the organization. Nursing documentation of medication administered, triage of patients, immunizations, education assisted us to ensure patient safety. And now the system, of course, cannot support the organization as it is in coming to be compliant with the new behavioral health component that has to be in place. So our organization will be going to another process, and we have already picked a new program that will be rolling out in a few months. At this point, we are trying to clean up all the existing leftover data that is in our system, making sure that all the charts are completed when it comes to orders, to remove any excess data that can be lost in the transition. So part of these goals that course outcomes was that the discussed nursing and healthcare informatics competencies as they relate to the goals of the clinical practice. By us initiating the EHR, that was one of the goals that we filled. Also, recognizing the use and importance of the nursing data for improving the practice. Our patient safety communication improved and became a more efficient system in the overall, especially with an organization having so many clinics at one time. Analyzing the web-based health content for literacy level, accuracy, reliability, and information for clinical population. Part of the meaningful use that we use for our patients is doing like the learning need assessments, but for our employees, it's also the training that we do in order to make sure that they know how to properly use the EHR system so that we can be maintained compliant with our EHR system, but also that we have standard practice of training across the board when it comes to our employees. One of the things that I have learned from this course has been that I wish I knew this back then. But of course, our systems have been changing, computer, programs have been changing, and so what might have been back then wouldn't have been applying now of what's going on in our system. With this new program that we're going to be changing to, I will also be part of the super users, which I volunteered for because I enjoy working on the computers and the programs that go, and teaching our staff and always being sure that I know what is going on so that I can take care of my staff, but of course our patients and their care, and making sure that the system is running and in regards that my clinic runs efficiently also. So I am very excited not just to finish this course, but to bring all of this back to my workplace. And when we start the second chapter, this new chapter of a new integration of a program, I will be able to be more beneficial to my organization with my knowledge base that I have learned from this class. Thank you.